Okay, so the starting position, your hips and knees are bent 90. And that's for all of these exercises except one of them. Your feet are together and your knees are apart, comfortably so. Okay? Not real wide, not a little bit. Just find that happy place where the hips feel maximally relaxed.
Okay.
All right? The first exercise is to roll it away from you and towards you. Away from you and towards you. 10 is a good number. You're only moving that gentle range that comes easily.
Okay.
All right? Now, my back doesn't really like away from it. My back really likes this.
Sure.
So you can emphasize one direction if the other doesn't feel helpful.
So is it advantageous to stretch it? Like, so yours is tight, or your back doesn't like one way, do you try to work that side more?
No.
No. Okay.
No. In fact, if one direction is tight or uncomfortable, it doesn't feel like it's going to release. If you emphasize the other direction 10 times, that might open up movement in the other direction.
Okay.
So maybe after that you'll be able to do 10 more.
Okay.
Okay? Then you do side to side. Okay? What happens is, because you're not being forceful, your body realizes that this is a-okay and it relaxes, and all of a sudden you're moving more. So it's sort of sneaking in the back door of the nervous system.
Okay.
You're not actively trying to increase motion, but it happens. Okay, it's kind of a Zen approach.
Sure.
All right, good. All right, then you're going to take both knees towards the outside of your right shoulder. It's about a 20-degree angle outward. Okay? And then you do the same thing to the left. Okay, knees are coming out here towards my hand.
And just in that where that easy range of motion.
Always.
Where it's comfortable.
Always. Okay? Then you're going to do circles to the left. All right? And then you're going to do circles to the right. Okay?
Okay.
This is my favorite. I'll always do 30 of these. You straighten out the knees, and then you go side to side. Got it?
Got it.
You're going to love it. You're going to absolutely love this one. It takes it all the way up to the lower thoracic. Okay? And then you're going to roll the ball up all the way to your thighs. Okay? So now my calves are on top of the ball. I'm going to straighten out my knees slightly. So I'm just going to push the ball away from me. All of a sudden, the ball is pulling up on my thigh bones, and it lifts my pelvis up off the floor. I'm not looking for a bridge. That would use a lot of muscle. That would bring in a bunch of muscle. No, I want gentle flexion of the lumbar spine from below, from the pelvis flexing, and the pelvis is being pulled away from me, so I'm getting traction. All right?
Okay.
So the traction you want to do for at least 2 minutes.
And just hold it there.
Yeah. Once you get in the position, then it becomes passive. I no longer have to push on my knees. I no longer have to use muscles, quads, to straighten out my knees. I just stay in this position, and it's totally passive. All of my muscles are relaxed, so it really isolates the lower lumbar spine.
Okay.
Okay? I do this every night. I absolutely love this particular one.
Yeah, makes
All right.
sense.
Very good. You can also repeat everything with one leg and then the other. So you'll recall the knee pointed out a little bit, and you're going up and down. All right? And you stay on one leg and go through everything and then do the other leg. All right? And then you do side to side, moving the heel. The heel goes left and right. Okay? And then the knee comes outside the right shoulder. And then you do circles left. And then you do circles right. Okay? And then you straighten out the knee. And then you go side to side. And it really does have a different effect. You'll notice that it really is different when you do just one leg versus both. And
Sure.
I can't say one is better than the other. I think they're both worthwhile.
So you use more just with a semi-pelvis, right? One side of the pelvis moves
Right.
that way.
Yeah, yeah. And then even this one gets interesting because it adds a rotation to the traction. So try it. For me, it feels like it's doing nothing, so I'm not going to waste my time. Okay? I'll try the other side. I have more pathology in my low back on the left side. I have scarred nerve roots and such, motorcycle wreck. And so if I straighten out the knee here, and I get lifting up, it doesn't do anything, so I'm not going to waste my time. Okay? And then you can sit on the ball. Oh, there's one more nice one where you put the feet on the front of the ball. Okay? And again, my hips and knees are bent 90 degrees. And now you go side to side. And this has a different effect than when the feet are on the very top of the ball. It better isolates hip rotation. So I find this worthwhile. I do that every night.
Okay.
Alrighty. And then I'm going to come back to that first position. I'm going to come back to where the ball hits me against my thighs. Okay? This is a tricky movement. I am going to glide my pelvis to the right and to the left. Okay? And there is only a small amount of movement there. Can you see it? It's real subtle.
Yeah.
Okay? So I'm not lifting one hip towards my shoulder. No. I'm taking the pelvis and going left and right. Left and right.
Sure.
Okay? You can, I'm going to try it with knees straight. I haven't experimented with that. It's a little freer when the knees are straight. Okay? Or you can do it without the ball. The way that I've done it in the past, I haven't done these for a little while, is just with knees bent, feet on the floor. I think this is better. I think this better isolates it.
Okay.
Okay? So side to side, 10 reps. And then you can sit on the ball. If you have to sit for 2 hours, it's nice if you can sit on the ball for at least 10 minutes. Yesterday I watched the Super Bowl at a friend's house, and I sat on the ball intermittently. I'd sit on it for 15, I'd stand up, move around. Movement is what's nice. If I'm working on my computer and I just reach for the mouse, there's the subtlest little movement that just happens just by shifting my weight. And that's good. The other ball that I have is a little taller than this, so it puts my hips a little higher than my knees. That's preferred. Okay? Sitting, you can do gentle rolling of your pelvis back and forth. Okay? You'll notice my whole body moves. You'll notice I get movement in my neck. Okay? And then you can go side to side. And again, you're only just doing that little tiny movement that comes easily. Okay? And then you can do circles left. And then you can do circles right. Okay? And you can do things like just slide down the ball. You'll get a little more flexion in your lumbar. Okay? And you can come way down. Like, yeah, and now you're actually getting some extension. Okay? And if your body likes it, go for it. It doesn't do much for me. But sliding down into flexion, this feels therapeutic for my body. All right? So a number of things you can do with the ball.
Okay.
All right? Thanks.